Hi, folks. My name is Mary Ann Snow. I'm the CEO and co-founder of Escara Biotech, and I am here with my co-founder and business partner, Dr. Yupeng Chen of the University of Connecticut, to give you a brief overview of our Janus-based nano technology that is such a primary driver of the projects that we're doing for the in-space manufacturing or NASA's InSPA program. We want to make sure that you've got clear understanding of the level of dedication that our team has, but also the confidence that we have in our technology as a translational technology that will have real benefits, not only to potential astronauts in the future, but also for patients on Earth. And with that, I'd like to turn this over to my partner, Yupeng Chen, and he's going to do a brief introduction of our team.
Thank you very much, Mary. And this is very precious opportunity for us to present our work to you. And Max, as you can see here, Max and Tristan are the PhD student in my lab, and they are the real heroes behind the scenes that complete all the work. And we will talk about our science today, but at a high level, and hopefully that can give you a background and some inspiration about our technology. So let me start overview about our technology here. So we are, give me 1 second, let me share my screen. We are working on a, a family of novel nanomaterials. We call it genus-based nanomaterials. And those technology was invented in our lab. The reason why we name this as Janus because Janus is in the ancient Roman religion. Janus is a god. Have two faces, and people believe Janus has one face looking to past, the other face looking to future. And our material, when we design them, they also have two faces. They are mimicking DNA-based pairs. As we know, we have ATGC as in the DNA. GC is a base pair, AT is a base pair. In this example, in our basic unit design, we have two sides of those unit, and one side is G, the other side is C. So the C side of the unit can bind with the G side of second unit through hydrogen bond, just like DNA-based pairs. And the third unit bind with the second one. And eventually, all 6 units will form a rosette plane. And those rosette plane can further stack together to form a nanotube, just like a pile of dishes in the kitchen. So, and if we look at those morphology and the size of those nanotubes, they are very similar to carbon nanotubes. As we know, carbon nanomaterials were Nobel Prize winning discovery. People had a high hope of using carbon nanomaterials for different biomedical applications. However, after 20 years, none of those products can be approved by FDA. That's because carbon nanotubes are too stable. They are formed by the carbon-carbon covalent bond. They are synthetic materials. They are not naturally exist in our biological system. If our cells and tissue uptake a carbon nanotube is like we take a diamond, we can never digest them. But for our nanotube, because we are mimicking those DNA-based pairs, mimicking those DNA chemistry, so they have excellent biocompatibility, they have excellent biodegradability, so they are perfectly for biomedical applications. And sometimes we can think about our nanomaterials as a biological carbon nanotube, but this is really a new category of nanomaterials. And we can self-assemble those nanomaterials at ambient temperature in water to form different structures for biomedical purpose. For example, if we put those nanotubes in water, they first self-assemble into put this small molecular unit in water, they will first self-assemble into nanotubes. And those nanotubes can combine with proteins and to form a scaffold. And those scaffold serves as a house for the cells. And so they support the stem cell growth and differentiation function. It can be used to repair damaged cartilage. And if we add messenger RNA with those nanotubes, and plus a sonication, then we can process them into very, very small nanoparticles. And those small nanoparticles can transport into cells and deliver messenger RNAs. So it serves as a carrier for messenger RNAs, and it can be used for anti-inflammation therapy, for anti-cancer therapy, and potentially vaccines as well. So this is the general overview about our technology, and later on, Max and Tristan will introduce the details about our technology.
All right, hello everybody. My name is Maxwell Indalina, and I am a PhD student in Dr. Chen's lab at UConn. And today I'll be giving a just introduction into our Janus-based nanomatrix technology. So before I start on that, I'd like to give you a quick background on cartilage tissue. Cartilage is an extremely important tissue, absorbing impact and allowing us to move around without any pain. However, it also lacks the ability to adequately repair itself. So once your cartilage becomes damaged, it typically stays that way. Even small injuries can compound, eventually stopping you from being active and doing what you love. On Earth, there's been a steady increase in cases of cartilage defects due to injuries sustained during sports, aging, a rise in obesity, and overall population growth. Currently, 58.5 million Americans, which is almost a quarter of the US adult population, report suffering from cartilage defects. In space, this problem continues. Microgravity removes the load applied to our joints. Cells sense this and stop maintaining cartilage tissue properly. As a result, exposure to microgravity causes cartilage to degrade. Further, because cartilage cells don't have the capacity to regenerate this tissue on their own, this leads to complications like joint pain and movement restriction for astronauts once they return back to Earth. These problems, both on Earth and in space, highlight the need for a tissue engineering approach, giving cells the scaffolding and resources they need to properly repair cartilage damage. So this is where our Janus-based nanomaterials, or JBNs, come into play. The assembly of our JBNs begins with our monomer in a lyophilized powder form. From here, we hydrate the powder, allowing the monomers to interact with one another in aqueous solution. As Dr. Chen said, the C of one monomer and the G of another monomer link together, and these result in the formation of a 6-unit ring called a rosette. These rosettes then undergo pi-pi stacking interactions in which they stack on top of each other like dinner plates. This forms our Janus-based nanotubes, or JBNTs. Finally, we add various proteins into our JBNTs, creating bundles of our Janus-based nanomatrix, or JBNM. These proteins can be both bioactive factors or structural proteins, and for the cartilage-focused JBNM I'll be talking about today, we used matrolin-1, which is a structural protein in cartilage that mediates cell adhesion. On Earth, our JBNM has already shown efficacy as a cartilage scaffold. When seeded with chondrocytes or cartilage cells, we observed a significant increase in cell number, area, perimeter, and other functional factors when compared to each individual component of the JBNM alone. This supports the idea that our JBNM encourages chondrocyte adhesion and improves cell functionality. We took this one step further using human mesenchymal stem cells, or MSCs. The JBNM not only recruited MSCs to its fibers, but it simulated the expression of key chondrogenic factors such as collagen type 2, aggrecan, and SOX9, which will lead to cartilage repair. We have and will continue to expand on JBNM development here on Earth, both in advanced 3D culture models and in animal studies. However, we realize that there may be room for improvement with our current strategy. When we make JBNM on Earth, we mix our nanotubes and proteins together in water. Through self-assembly, the nanomatrix forms together. However, gravity-driven forces like convection cause sedimentation of these materials, making them sink before the assembly process is 100% complete. However, in space, we hypothesized the lack of convection would increase the duration of self-assembly, allowing our JBM to form larger, more homogeneous bundles. So to achieve this growth while simultaneously minimizing the resources and labor required, we developed a one-pot reaction for JBN assembly. First, in our lab on Earth, we lyophilized freshly made JBN monomers inside a cuvette. And because they're lyophilized in this powder form, the assembly does not yet occur, ensuring that microgravity can have a considerable impact on their growth. When ready, astronauts then use a plastic syringe of water to hydrate the cuvettes. This suspends the monomer powder in solution, beginning the formation of our Janus-based nanotubes, or JBNTs. And finally, to create the JBN, a protein solution is pipetted into the cuvette. After some slight mixing, the protein will successfully come together with our JBNTs, creating our JBN in solution. While other nanomaterials require high temperatures, chemical catalysts, or other stringent fabrication conditions, our JBN can self-assemble in water at room temperature, making them ideal candidates for in-space manufacturing. Here's a one-pot reaction in practice, and this footage is from our previous SpaceX-31 mission, and it's sped up a little bit just to save some time. You can see the first astronaut on the left using a plastic syringe to hydrate JBN powder inside of a cuvette. After all the water is expelled from the syringe, the astronaut then shakes the cuvette to ensure all powder on the inner walls has been hydrated. Next, they obtain a different cuvette filled with the protein solution. Using a pipette, they transfer this protein into our initial cuvette containing our JBN solution. After pipetting up and down twice to encourage assembly, the JBN has been created inside this cuvette. So far, we've completed the in-space manufacturing of our JBN on the AX2 mission in spring of 2023 and the SpaceX-31 mission this last fall. We're currently analyzing our samples from SpaceX-31, and for the rest of the presentation, I'll be going over results from AX2. So once we got our samples back, we first investigated how assembly in space changed their structural properties. We ran each sample through UV visible spectroscopy, and we noticed that microgravity greatly improved the JBN's homogeneity. On the left, we have our flight samples, and you can see there's very little deviation in absorbance readings across the UV spectrum. While our ground samples on the right show relatively small deviations in absorbance, these are indicative of structural inconsistencies caused by convection. To confirm this, we performed transmission electron microscopy, or TEM. This imaging method lets us take high-resolution images of our samples at the nanoscale. These images let us realize that not only were the flight samples more homogeneous, but they also appeared to become thicker in space. After going through and measuring these TEM images, both through distance mapping functions and manually, we found that the lack of convection led to a quantitative increase in our strand thickness. We observed an increase in protein incorporation into these bundles, which likely led to their higher width. And finally, after confirming those structural changes, we wanted to study if they had any impact on the JBN's biological efficacy. We performed an adhesion study in which we seeded chondrocytes on both types of our nanomatrix, cultured for 4 hours, and then washed any non-adherent cells off. We observed a significant increase in overall cell area of JBNs made in orbit compared to those produced on Earth. To summarize, the in-space manufacturing of our JBNs led to an improved homogeneity between our samples, an increased thickness of our JBN bundles, a higher degree of protein incorporation into our scaffold, and finally, a translation of these structural improvements to an enhanced cell adhesion, defining a key structure-function relationship between thicker bundles and biological efficacy enabled by in-space manufacturing. In our SpaceX-31 mission and beyond, we will expand the sample size of JBNs created in space, observe how microgravity affects different aspects of the assembly process, potentially leading to the discovery of optimal fabrication conditions, examine if in-space manufacturing can improve chronogenesis, and apply JBNs made in space to more rigorous testing. And on behalf of the Yukon team, as well as collaborators at Baylor University, we'd like to thank you very much for your attention and interest in this project.
Max, thank you very much for taking us through the JBN-M overview. Now we'd like to turn it over to Tristan Cody, another member of our lab science team. Tristan is going to do an overview of our Janus-based nanoparticles, which can be used for an osteoarthritis application, potential cancer applications in the future, and other disease indications. And with that, Tristan, take it away.
Thank you, Marianne. Hi, everyone. I'm Tristan. I'm also a PhD student in Yuping Chen's lab at the University of Connecticut. And I'll be talking about Janus-based nanoparticles for targeting cartilage with mRNA delivery on Earth and in space. So osteoarthritis affects over 32.5 million US adults, and it's a disease that has no FDA-approved disease-modifying drug available for it. Despite that, the market for osteoarthritis therapies is expected to grow to 15.7 billion by 2030. There are some injections available that are capable of addressing pain and mobility issues, but those are approved as medical devices because they don't provide any disease-modifying cure. The anakinra peptide has shown some efficacy in anti-inflammatory applications, but it wasn't able to treat osteoarthritis. But we think that an mRNA encoding this therapeutic peptide can instead be used in order to inhibit joint inflammation and pain. So in osteoarthritis, cartilage is the most heavily impacted tissue. It has a low cell density with a thick, avascular, negatively charged ECM, meaning that it is very difficult to deliver drugs to. Conventional lipid nanoparticles aren't able to penetrate cartilage to deliver mRNA, but our material, JBNP, is uniquely suited to overcome these challenges and efficiently deliver mRNA. Our Janus-based nanoparticles are fabricated from the same starting materials as all Janus-based nanomaterials, called Janus-based nanotubes. Here, JBNT and RNA are mixed together by simple pipetting to form a JBNT and RNA complex where the charge-charge interactions between the negatively charged RNA and the positively charged nanotubes create RNA binding regions, and the repulsion between the nanotubes leaves non-RNA binding regions. Then, when we sonicate the materials, where the power of sonication is strong enough to chop up the nanopieces, removing the nanotubes at the non-binding regions, but weak enough to leave the RNA binding regions intact. This leaves us with RNA that's tightly bound between nanotube bundles and a nanoparticle that stands at around 100 nanometers long and 5 to 20 nanometers wide. One of the key advantages of JBNP is that we can engineer its size and shape for enhanced penetration into the cartilage. And when we take a practical look at the difference in delivery between a non-rod shaped and a rod shaped JBNP, which we can achieve by changing the ratios of components and the sonication power, it's clear that the non-rod shaped JBNP cannot penetrate the cartilage deeply, while the rod shaped JBNP can due to its slim profile. We demonstrated this directly as seen on the right in cross sections of cartilage where non-rod JBNPs aggregate on the edge of the cartilage, but rod-shaped JBNPs are able to penetrate the cartilage and deliver to the cells. So we can say that by varying the fabrication and processing methods of JBNP, we're able to control how well it penetrates matrix-rich cartilage. With the known ability to penetrate cartilage, we wanted to do a proof of concept study where we used JBNP to deliver a therapeutic mRNA to cartilage against osteoarthritis in a mouse model. And to do this, we used the destabilization of the medial meniscus mouse model of osteoarthritis, where we surgically induced OA in the 129 SVE mouse strain. We then delivered JBNP carrying the interleukin-1 receptor agonist anakinra mRNA to the knee joint cartilage via intra-articular injection, which is delivered and translated into the anakinra peptide. That would be able to inhibit osteoarthritis progression. First, we needed to check that we could deliver JBNP to cartilage intra-articularly, and we could. So on the right in this, on the left in this knee joint cross section, we see that JBNP delivered a magenta mRNA across the knee joint to the synovium, the meniscus, and the cartilage. And we also needed to check that the cartilage-delivered mRNA was capable of producing a protein. And in Western blot, we saw strong bands for the interleukin-1 receptor agonist protein, and an over 10 times increase in relative interleukin-1 receptor agonist protein expression. So knowing that we could achieve meaningful delivery, our study took the following form. We started by inducing OA by DMM surgery on day 0, and every week following this for 7 weeks, we did a behavioral study followed by injection of the JBNPs. And on week 8, we collected their knee joints. So in the first part of the behavioral study, this consisted of a gait analysis where we tracked the gait of the treated and untreated mice. We then made measurements of their paw area, stance length, sway length, and stride length. And what we saw was that in groups treated with JBNP, seen in red here, their paw area and stance length were much higher and more similar to the healthy control groups than that of the group that didn't receive any treatment at all. And this tells us that the mice treated with JBNP maintained a very healthy gait pattern and therefore were not experiencing pain or immobility from cartilage degradation. We then continued to pain sensitivity testing, where we understand that in a healthy state, the mice are quicker to sense stimuli and react than in a state where pain from cartilage degradation is making it more difficult for them to sense stimuli or other pain. So first, on hot plate testing, the treatment group mice responded much quicker than the non-treated mice, which was very similar to the response of the healthy control group. This tells us that the treatment group was not experiencing more pain than the healthy control group, and it likely did not have degenerated cartilage. Then on von Frey testing, the treatment group mice noticed the stimuli at a lower threshold than the non-treated mice, which was again very, very similar to the healthy control group. This also tells us that the mice in the treatment group were not experiencing pain from cartilage degradation and likely were not experiencing the progression of osteoarthritis. So after collection of their knee joints at the end of the study, we first conducted micro-CT, where we saw that the untreated mice with osteoarthritis had significant osteophyte development, which is a key indicator of osteoarthritis progression. But the mice treated with JBNP demonstrated no osteophyte formation at all, lacking any signs of progressive osteoarthritis. On histology, we essentially saw the same thing. On the top, the treatment group preserved a thicker and healthier cartilage layer than the non-treated group. Then on cleaved aggregate staining, the same is true again, where we see that the JBNP treatment group showed no signs of cartilage degradation, but the untreated group showed extensive cartilage degradation. These results in combination with the behavioral study data tell us that the JBNP delivered a viable copy of the interleukin-1 receptor agonist mRNA to chondrocytes in the knee joint, and they were able to produce good copies of the therapeutic protein. This means that JBNP can be used to deliver a bioactive mRNA to cartilage in the knee joint. So we've already demonstrated the ability of JBNP to efficiently penetrate cartilage and deliver mRNA, which is something that conventional spheroid lipid nanoparticles have immense difficulty doing. We also have significant additional data beyond that, what is included in this presentation, demonstrating a list of different technical advances of JBNP that in some cases, spherical lipid nanoparticles are unable to achieve. For instance, reduced liver accumulation, no induction of adaptive immunogenicity, low toxicity, excellent endosomal escape, room temperature stability, and versatility to deliver different cargoes. Our ability to avoid adaptive immunogenicity and maintain this room temperature stability are key technical advantage of JBNP that LNP is not able to achieve. So we now know that JBNP has many key advantages, including the ability to penetrate cartilage and stabilize mRNA at ambient temperatures. And these advantages uniquely position us to take advantage of microgravity and investigate the implications of JBNP in space. So by sending JBNP to space, we aim to understand firstly how microgravity affects the cartilage penetrating ability of JBNP, and secondly, how well JBNP can stabilize mRNA to withstand spaceflight. Our results from the SpaceX 30 mission led us to discover that the stabilizing effect of JBNP on mRNA may allow for the use of JBNP to deliver mRNA in in-space applications without any cold chain maintenance. This could be include to treat osteoarthritis in astronauts, which is a very common occurrence following exposure to microgravity. Now, when assembling JBNP on ISS, there are 3 simple steps involved. The first assembly step involves hydrating lyophilized powders in cuvettes, where the rosette planes are self-assembling into nanotubes. In the second assembly step, RNA is mixed with JBNT, where they form the larger, non-sonicated JBNT and RNA complex. In the final step, cuvettes are sonicated, where the larger non-sonicated complexes are chopped up into rod-shaped JBNPs capable of penetrating the cartilage. On ISS, we have our own custom set of tools that are capable of sonicating the materials and giving us spectrophotometric readings. In the video here, you can see the cuvettes of JBNP being rapidly and easily sonicated using our sonicator on ISS. This is unique to JBNP, as we do not sonicate JBNM or other materials on the ISS. When we get our samples back on Earth after our last mission, SpaceX 30, we noticed an improved uniformity in JBNP assembly and a maintenance of JBNP bioactivity withstanding the ambient conditions of spaceflight. First, we saw an absorbance decrease in flight samples compared to ground samples, where the dotted lines here on this graph are ground samples and the full lines are flight samples. A decrease in the absorbance here indicates a much better formation of JBNP. We also then transfected the JBNP into cells on Earth, 45 days after initial component preparation and storage at ambient temperatures, and we amazingly saw that they were able to deliver functional copies of RNA to the cells. And in the case of the mRNA, as we see on the right-hand side, they were also able to produce the fluorescent protein. Together, this tells us that there's a big improvement in formation of the JBNP in microgravity when compared to ground conditions. This is likely due to the absence of sedimentation forces in microgravity, where the resultant JBNP experiences less aggregation, a better rod shape, and an improved encapsulation efficiency. A subsequent improvement in bioactivity follows. So in summary, I'll leave you with a few key points about JBNP. First, JBNP are nanorods that are capable of cartilage penetration and mRNA delivery. They're able to deliver an interleukin-1 receptor agonist mRNA to cartilage in a mouse model to inhibit the progression of osteoarthritis, and they're also able to maintain stability and bioactivity at ambient temperatures, including in spaceflight. So this highlights many of the key advantages of JBNP, and that's all.
Thank you, Tristan. This concludes our overview of our Janus-based nanotechnology. We want to thank so many of you who have been responsible for the advances in our science and also our capability to have access to a microgravity environment. In a little less than 1 year, we have been able to access the International Space Station 3 times to make Janus-based nanoparticles and once for an additional project related to an entirely new technology called the tissue chip. Because of your commitment to science, because of the help and support that you have given us along the way, we've been able to make such astonishing progress in such a short timeline. Yupeng, our science team, and all of the folks on the DNA Nano team want to thank you so much for all your help and support. And please, if you ever have additional questions, reach out to us. We love the fact that you're so excited about what we do. And we hope to be able to continue to update you in the future. Thank you so much. Have a wonderful new year, and we look forward to working with you again on our next flight, SpaceX 32. Thank you.